Hello, I welcome you all in today's session. We are celebrating Women's Day this year by spreading awareness about cancer detection and care. The theme of this program is Yes, I can detect cancer early. Yes, I can survive cancer. In this series of events, we are talking various field experts about early cancer detection and care for women. Cancer is a disease that has potential to debilitate the life of a person physically, emotionally, and economically in a manner other ailments can. Women are custodians of our family health, playing a critical role in maintaining the health and well-being of our communities. In other words, healthy women will ensure healthy families, healthy communities, and a healthy nation. Hi, so today we have Dr. Sewanti Limaye, who is Director for Medical and Precision Oncology at Sir H.N. Reliance Hospital in Mumbai. Dr. Sewanti, my first question in the context of today's topic of discussion is, what are the common cancer women should be watchful of?
So, one of the commonest cancers that is found in women is, of course, breast cancer. But in Indian women, the rates of oral cavity cancers are also very high. So, other than women's malignancies like breast cancer, cervix cancer, ovarian cancer, oral cavity cancer is also very prevalent, and you can understand why, because a lot of women in India are still chewing tobacco. They're not smoking as much, but they are chewing tobacco, and so quite high predilection of oral cavity cancers in women, and really a need to be advocating for tobacco cessation, even in women in India.
So what will be your message for those women who are into tobacco chewing or in smoking in respect to cancer screening?
Let me just tell you about general cancer screening for women. And actually, in general, the screening measures that we advocate for women are self-breast examination, clinical breast examination, and breast mammograms or sonograms starting the age of 50 and starting the age of 40 if they have a family history of breast cancer. Yearly screening measures should be taken. The other cancer that can be prevented with proper screening is cervix cancer. And for cervical cancer, also we recommend pap smears, 3 in a row at a yearly basis. And then once those 3 are negative, we recommend every 3 yearly. And most women who are sexually active are recommended to undergo pap smear examination and follow up. And so very critical, these 2 screenings. Now, for women who are chewing tobacco or are exposed to smoking first-hand or second-hand, of course, the rules are different. So oral health examination is one of the things that we always recommend for people who are chewing tobacco, even for people who are smoking. And there are 8 steps of oral cavity screening that should be followed. All crevices of the mouth should be examined properly. A lot of oral maxillofacial surgeons or dentists are adept at doing such an examination, and that's something that I would also recommend. But first of all, I would recommend that they quit the tobacco, quit chewing tobacco, quit smoking. That's the biggest message that one would want to bring to the fore.
Okay, great. So if women has a family history, what would be your recommendation? And if someone is diagnosed with...
That's a great question. So if someone is coming in with a family history of breast or ovarian cancer, they should start screening measures at least 10 years ahead of what their close family member was diagnosed at. So let's say someone was diagnosed at 50 years of age with breast cancer, and there is another family member, close family member, then the third family, who's the point of screening, should at least start screening 10 years ahead of time. And we know that 10% of breast cancers and ovarian cancers are actually hereditary. And so if there are family history, they should be screened for the disease. They should also undergo genetic counseling to figure out the genomic tree, and they should get appropriate tests done. These are hereditary germline profile tests done with the help of either a blood test or a saliva test, with which one can figure out whether they are carrying a gene that puts them at a higher risk to develop either breast cancer or ovarian cancer or other malignancies, and preventative actions can be taken. So One, these tests are very critical to help understand that person's risk. It also helps understand what is the risk in the family, so to their sibling, to their children. So very critical, if there is a family history of cancer, specifically breast and ovarian cancer, women should understand that angle and get genetic counseling done and appropriate genetic screening done to understand their risk and move towards prevention if at all it is preventable.
Okay.
Very important to understand that.
Great. And what will be your final recommendation for the women who are already diagnosed with cancer, and regarding like how they should care about their cancer, and what will be their precautionary steps they should be taking for?
So that's again a very good question. Mainly, we have to understand that large percentages of cancers in India are still being diagnosed at advanced stage. We are capturing our patients late. So early diagnosis does save lives. So do the screening, that's primarily important. However, if diagnosed already with cancer, whether it's locally advanced or early stage, the first thing I recommend is that they have to get to the right center. So most cancers should at least be guided, the therapy should at least be guided by a multidisciplinary cancer center where all the information regarding the cancer is pieced together and right directions given to the patient. If diagnosed in higher stage, one of the things that I advocate and stand for is precision oncology, wherein understanding the biomarkers to understand the biology of the disease and treat it better comes front and center. So really today the time has gone for umbrella therapy, for one size fits all, for bucket chemotherapy. I think the time has come in, and it has been there for the last decade, wherein you identify specific biomarkers and tailor the treatment, strategize the treatment as per the patient's genomic signature, so that the time is preserved, because it's race against time for advanced disease patients. You cannot lose out on time, you cannot lose out on money, you cannot lose out on the energy. So it's extremely important to strategize the treatment well, and that treatment should be guided as per the genomic signature that is seen in that advanced stage patient, whether it's breast cancer, whether it's ovarian cancer, or any other malignancies that the patient is diagnosed with.
Great. Thank you very much.
If I would leave you with one message, it would be personalize the treatment to the genomic signature of that patient. Early diagnosis saves lives, and eat healthy, exercise, lose weight, because that's only one known way of reducing cancer causation other than quitting tobacco and chewing tobacco and alcohol, which are the other carcinogens that we are all aware of.
Thank you, Dr. Sewanti, for insightful discussions. Thank you very much for joining us today. Thank you.
Thank you. Thanks for having me.